Welcome, everyone. We'll get started in just a couple of minutes. We are going to allow a few folks to join us. And if you all are settled, feel free to let us know where you're logging in from or serving in the chat. It'd be great to get some context as we explore our exciting conversation here today. All right, Henry County, Iowa, Washington. All right, Mason County. Thanks for being with us, everyone. All right, Multnomah County, Oregon. All right. Commissioner Stegman is cheering you all on. Trailblazers. See some more folks from Multnomah, excuse me. And then, okay, Fallon County. Wonderful. St. Croix County, Wisconsin. Have family there. All right. New York State. Wonderful. Thanks for being with us. Okay, we're currently represented from the east to the west. Wonderful. We'll get started in just 2 minutes. We'll let people get settled, and then we'll get started to have an efficient yet impactful conversation with you all today. Okay. And then as we get ready to begin, you all can feel free to just drop your questions or comments in the chat. We have team members from Forward here that will grab those questions, and when we get to the Q&A, we'll make sure that we cover those. So feel free to continue with us in the conversation. Okay, I'm just going to kick us off with a welcome, and then we'll go into self-introductions, and then we'll get started today. All right, hello everyone again. My name is Asia Brown, and I serve as Strategic Impact Partner for Forward. I've also served in government administration, development for 20 years. 8 of those years, I served as mayor of the city of Compton. Really excited to have this conversation today and really deep dive and really focus on solutions. I'm really thrilled to be joined with Multnomah County Commissioner Lori Stegman, that really has been spearheading and leading the way to help revolutionize access to public resources, which is what we're here to talk about today. We will really give you all a walkthrough about how Multnomah has enabled residents to apply for up to 20 programs with just one application. They've streamlined the applicant experience, enhanced data security, optimized resource allocation, and then we'll be talking about strategies and just the new technologies that are now available for you all in the marketplace at large, and that really help drive the successes that we're going to talk about today, and then how we can definitely apply those to your jurisdictions and even how efficient and cost effective they are to saving time and program admin resources. So before we begin getting into our conversation today, I am honored to have the opportunity to introduce our esteemed panelists. They bring a wealth of experience and knowledge to this discussion. And then we'll just start with brief self-introductions, as I shared earlier. I believe we're still waiting for Dr. Goldsmith, and we'll give him an intro as he comes in, but he is a professor at the practice at Urban Policies School for Harvard Kennedy School, excuse me. They have a powerful institute of politics that are really tracking benefits access across the nation. And then thrilled to be with our trailblazer here, Commissioner Lori Stegman. She represents District 4, Commissioner at Multnomah County. I'll hand it to you, Lori.
Thank you, Asia, and thank you to all of my friends and partners at Forward for hosting us today. I'm Lori Stegman. I'm a Multnomah County Commissioner here in Portland, Oregon. I have been a commissioner for 8 years, and one of the things that I've been super focused on is around economic mobility. And what we're going to talk about are tools and ways that we can improve economic mobility for folks today. So thank you for having me.
Thank you for being with us. Look forward to our conversation today. I've been messaged. I see Dr. Goldsmith is in the chat. We'll give him the correct link to join us as a panelist. Not sure, Tina, if you're able to just bring him in. And then I'll hand it over to Kelsey Martin, who is our Director of Client Services at Forward.
Thanks, Asia. Hello, everyone. I'm Kelsey Martin, Director of Client Services here at Forward. My team oversees the programs that we administer here. And so I was excited and honored to be a part of this Multnomah County pilot program that we administered that Commissioner Stegman championed. And so my team worked really closely with our engineers to build this thing. And it was complicated, but we're excited to kind of talk you through and walk you through how we were able to execute it. And as well, I have the lens of some of you all, the lens that some of you all have, which is I used to work in city government as well, in housing at the city of Spokane. And then even prior to that, I was in the nonprofit side, working as the managing a domestic violence shelter. So, navigating, helping the population kind of navigate public systems is complicated. And so all of that kind of led up to helping build this pilot. And it was a really exciting moment to be able to use some lessons that I've learned in my past, and really some of the barriers that we all know that accessing public programs has, and to build this thing. So it was really exciting. Thanks, Asia.
Thanks, Kelsey. I share proudly that Kelsey and her team is really where the rubber meets the road at Forward. And so they do the great work of designing just powerful solutions for the marketplace in partnership with all of you. I am honored to introduce our co-panelist, Dr. Stephen Goldsmith. I gave a light introduction. I'm glad you're able to be with us, Stephen. We'll look forward to you sharing a little bit about you, and then we'll hop right into our conversation today.
Thanks. I could see you and I could listen to you. I thought I was joining before, so I appreciate the introduction and good to be with the commissioner. I'm Steve Goldsmith. I run a center on policy at the Bloomberg Center for Cities at Harvard Kennedy School. I was a mayor, a deputy mayor, and a few other things as I've been in local government for about 30 years. And now I specialize on the intersection between innovation, technology, and local government. And it's good to be here.
Thanks, Stephen. We'll hop right into our conversation and move forward. So first, we'll have an agenda, and this is just a quick look about what we'll cover today. We're really excited to hop into just a quick overview of Forward. We'll spend the majority of our time talking about the great work that we're doing and helping to support Multnomah County with their Common Application Program. And then we'll engage all of you. You all have taken the time to be with us, so we look forward to learning from you all, listening to some of your challenges and talking about solutions in real time around integrated eligibility systems. And then we'll have plenty of time for a live demo and then additional Q&A at the end. So we're going to have a great time together today, and we'll hop right into it. All right, and about Forward. So Forward, happy to kick things off. We are a company that is not just about technology or data, but we're really about partnering and empowering jurisdictions across the nation to drive data-informed decisions with powerful data dashboards and human-centered technology. So amid the pandemic, our customers were like, we love data dashboards. All of this is great, but the house is on fire. We need to figure out how do we get resources and funding to our residents and small businesses. And so we expanded our offerings in real time to say, we're here to help. And so we designed a powerful platform that helps to administer assistance programs. We specialize in getting resources to families and businesses quickly and efficiently, and then also safely. And to date, we've dispersed over $1 billion in programmatic funds and have served over 300 families and small businesses. And so now, to give you a closer look at how we implement our solutions, I'll hand it over to Kelsey Martin, again, our Director of Client Services, where the rubber meets the road at Forward, who will walk us through how Forward provides end-to-end public service sector solutions. Thanks,
Asia. So as Asia mentioned, Forward provides this managed service solutions for program administration, really designed to increase back-end capacity, to foster interagency collaboration, optimize resource allocation, and really ultimately improve that kind of applicant experience. from rental assistance to housing services, small business loans, weatherization rebates, cash assistance. We've done all those kinds of programs. And we really oversee every facet of program administration, from initial program design to the collection of applications, to eligibility determination, payment processing, and then finally, I know this is the hot topic, compliance reporting. So we do it all.
Thanks, Kelsey. And so as we really take a closer look and zoom in on the challenges facing Americans in accessing benefits, low-income Americans are systemically disproportionately impacted by barriers of access. And so we'll take a little moment to talk about this and really, unfortunately, the hurdles that exist in current governmental systems and how we are here to help. We have over 40% of Americans encounter difficulties accessing eligibility and also just really providing access to benefits. And so if they can't access programs and resources, then they ultimately obviously cannot receive the critical help that they need. And so there's a combination of complex applications, often that have over 100 questions add to the challenges. In addition, because programs are disparate, they generally have to continue to repopulate their information, vital documentation over and over again to get the resource that they need, in addition to physically oftentimes navigating governmental offices to get the help that they need, which can be very frustrating. Not to even compact that greater, but language barriers, particularly impacting Latino adults, while those with developmental disabilities or even physical disabilities report delays in inadequate treatment. And so lastly, with 55% of low-income adults seeking assistance, it's clear that the current system needs improvement. And Forward's integrated eligibility solutions are designed to overcome these barriers and really simplify access for everyone. It's very difficult to be in a place of need and also have to really be forced to navigate so many different systems that have their own unique challenges. And so we're really excited to talk about how we help. I'll hand it to you, Kelsey.
Yeah, we're really excited to share this Multnomah County Common Application Program. It's this new initiative that really leverages Forward's integrated eligibility solution. This program powers a portal where constituents can apply to multiple programs using just one application. This innovation really has simplified the process for applicants and enhanced the operational efficiency for Multnomah County. With that kind of high-level overview, I'll pass it back to Asia actually to dive into our panel and with Commissioner segment discussion to explore how these solutions have made a real impact on the ground.
Thanks, Kelsey. I'm excited to get into what we're here to talk about today. And so, Commissioner Stegman, my first question for you is, could you just please take a moment to share how Multnomah's Common Application Program has specifically impacted residents in your district? And then what are some of the measurable outcomes that you all have observed?
Thank you, Asia. Those are great questions. So I wanted to share a little bit about kind of the genesis of the Common Application. So early on in my term as a county commissioner, my staff and I, we were hosting a family night event at one of our local family shelters in my district. So it was a great night. We had games, we had science experiments, food, and great conversations with the families that were living there. So we had met a young woman who lived there and she was pregnant, and we wanted to make sure that she knew about what resources were available to her. While she knew about some programs like SNAP, the Supplemental Nutrition Assistance Program, otherwise known as food assistance, she was not aware of WIC, which is a special supplemental nutrition program specifically for women, infants, and children. This program helps safeguard the health of low-income pregnant, postpartum, and breastfeeding women, as well as infants and children up to age 5 who are at nutritional risk by providing nutritious foods to supplement their diets. This program also provides information on healthy eating, supports and promotes breastfeeding, and makes referrals to healthcare providers. So this encounter was really the genesis of the Common Application, and it really highlighted the barriers to accessing available resources for many of our community members. After working with Forward, our community-based organizations and our county departments on strategies on how to reduce these barriers, we developed the Common Application, as well as a real-time dashboard. So on this slide, this is the dashboard that Forward helped us develop. We are able to track the number of applications and programs applied for since May of 2024. So we know we are making a difference in people's lives. So you can see out of 126 applications so far, 17 were for WIC, 2 were for Healthy Birth Initiatives, and 4 were for the First Time Moms program. In total, that represents about 18% for services just for moms and babies. I can't help but think how important and impactful that is to help provide a solid foundation for families in our community. But we also know that we have to make it easier for folks to access this assistance. Prior to implementing the Common Application, residents would need to click through a website more than 20 times, and that's just to find and access the application. Then, once the application was finally found, they'd have to answer somewhere around 100 questions to apply. I don't know how many of you have experienced what I call question fatigue, but I have, where we start filling out a form, and after numerous questions, at some point, we just decide this is too many questions, it's too difficult, or it's not worth it. But with the Common Application, we were able to address that barrier by reducing not only the number of clicks to get to the actual form or the website, but also the number of questions asked. For families, questions went down from 84 to just 19 questions. And for seniors, the number of questions went from 70 to just 17. And that is to apply for multiple programs using just one application. By simplifying the application, we were able to enhance user experience by reducing inputs and clicks by 80 to 90%.
That's significant, Commissioner Stegman, and thank you for just sharing the impetus of the leadership and really the powerful outcomes experienced by your community members, and especially those that have the greatest need and that have the greatest challenges to accessing the system. As we proceed forward, I'd love to just hear about what were just some of the initial challenges. I know folks that are listening in, they're like, this just sounds wonderful and that sounds great, but how did you all make this happen? I'd love to just hear your perspective on a couple of challenges that you faced. How did you overcome them? And Kelsey, feel free to hop in if you feel effective. I'll hand it back to you.
Thank you, Asia. So a really big hurdle, and for any of you, we've got past mayors here, past electeds, you all know that the hurdle around data sharing and compliance is huge. And how we could collect confidential information for multiple programs while only sharing pertinent data with the appropriate entities. But Forward was really a lifesaver, but because they are a third party, meaning Multnomah County was not collecting, nor do we even have access to the data itself, we were able to shield ourselves from that issue. Forward is able to ensure the Common Application data that we collect is HIPAA compliant and is stored in a Microsoft cloud. Another challenge that we had, and I don't know, Kelsey, did you have anything you wanted to add to that?
One thing that one small point, Commissioner Stegman, is, we really made sure that our contractual agreement accounted for the WCAG compliance requirements, which is web content accessibility guidelines. And so really making sure that all of everything that we set up that Multnomah County had required on their end, that Forward also, that level was ensured universally across what we set up. So what we set up was really an extension of what Multnomah County standards require.
Thank you, Kelsey. So that was absolutely this was a go, no go, a decision point in whether the Common Application would move forward or not. Another challenge that's been mentioned is how we can overcome the language barriers. So in my district in Portland, Oregon, Multnomah County, specifically in the Rockwood neighborhood where I grew up, there are over 80 different languages spoken. So it was incredibly important that residents have access to the application in their own language, which is why the Common Application has been translated into the 4 main languages spoken in East Multnomah County, which are Russian, Spanish, Vietnamese, and Somali. We were also concerned because not everybody has access to a computer. Not everybody knows how to access the internet. So we wanted to make sure that they had help in navigating the digital application. So one of the options that we offer residents is to speak directly to a representative who can assist them in completing the application. And with Forward's assistance, we included a call center for those who may not have access to the internet or computers. The call center, which I'm so excited to report, is available in 68 languages, with interpreters available to walk individuals through the application process. So Kelsey, did you have anything to add on the language? Okay.
No.
Okay, and then I think the final thing I would say on that is that we also encountered some difficulty in incorporating certain county, state, and federal programs due to information sharing regulations or their inability to accept digital forms. For example, we had hoped to include SNAP, the food assistance benefit, but since it couldn't be integrated into the Common Application because they require a separate login and password, we aren't yet at a point where we can include this important resource. But I am optimistic that in the future, we can overcome this hurdle and collaborate with our state partners to better align and integrate these systems.
Thank you, Commissioner. That was just one of the questions that we received in the chat. Is this integrated with Oregon's One system? You answered that question. It is not yet, but I know that it is on your agenda. And we look forward to the continual expansion of streamlining access for those that are in your state and county. My next question is just relative to community feedback. We've all been community servants here on this line, and we'd really love to know how you all incorporated community feedback in your initiative, and just how has the community responded to Common Application Initiative?
Thank you, Asia. Well, the feedback has been phenomenal, and it really just really warms my heart. Nonprofits and CBOs are really, really excited to have this tool in their toolbox, since we know that they are often the first point of contact for many of our culturally specific community members. Not only does it connect people to resources that can result in economic stability and mobility. And by the way, I think Stephen will bring this up, that sometimes we were talking about economic mobility, and that economic mobility doesn't just mean that you're low income. It means that you're on a trajectory to increase your living standards and your wages. So it's not just for low income folks. So what the Common Application can do is it actually reduces the workload for nonprofits and CBOs. They don't have to know about every single app or every single program in existence. They just have to know how to access the Common Application. And with a workforce shortage that we are all experiencing in nearly every field, this is a tremendous benefit to them. They spend so much of their time doing exactly what the Common Application does, from identifying resources to helping people apply for them, as well as providing translation and ensuring complete submissions. This frees them to do the more complex work that they are often required to do, and it helps reduce the need for additional staffing.
Thank you so much, Commissioner. We are going to pivot and talk a little bit more from a micro perspective of how Forward works to implement these systems, and then we'll take a step out and hear from Dr. Goldsmith and really just glean from his expertise about what is happening across the nation to close the benefits access gap. And so, Kelsey, as I shift over to you, your team again plays the pivotal role in making these systems and platforms work for community. Could you just walk us through the implementation process? Like what happens once folks decide to work with Forward? how does this system execute? What are some of the key steps to roll out to make sure that this program is launched effectively, and then also from a compliance standpoint?
Yeah, thanks. So, we really worked closely with the county representatives, both Commissioner Stegman as well as additional teams there to really identify these 20 programs that we wanted included in the common application, and diving into what all of each of these applications look like, down to every data field that every application was collecting, finding commonalities, finding differences, finding kind of the web of how all of these would potentially spider off. And I think many of you would probably know a lot of these have a lot of commonalities. And so people, every time they were applying to each one of these different programs, were filling out their name 20 different times. They were filling out their address 20 different times, their birthday. So, really understanding how we could streamline was kind of the impetus of all of this. And so, lots of commonalities found, and really condensing those duplicative questions was first priority, and we were able to do that pretty quickly. And once we did that, really identifying as well, then how we can really streamline and cut down on the time that someone would be filling out an application. So, for example, as Commissioner Stegman talked about earlier, this woman who was filling out an application who didn't know about WIC. Someone who may or may not be a veteran doesn't necessarily need to answer the same questions that someone who may or may not be eligible for a program like WIC. And so really understanding, okay, yes or no to veteran means that they get these set of questions. Yes or no to being a parent gets these set of questions. Yes or no, for these various different the water program. So all of those nuances really was important to understand how we can save these people time on filling out applications. And then the final kind of point that we worked out early on in the program design, as again, Commissioner Stegman spoke about earlier, was ensuring that all of this was compliant with county standards, ensuring that web content accessibility guidelines were met so that the internal county IT teams gave their stamp of approval on all this was crucial, because the way we designed it at Forward needed to meet county standards.
Thanks, Kelsey. That was very insightful. And I'd like to just ask if you can take a moment to just elaborate a little bit more on Forward's technology, such as like multi-program eligibility, the real-time reporting features, and then really what has improved from an efficiency and effectiveness standpoint from the administration of public assistance programs in partnership with Multnomah County.
Yeah, the logic was really important to really identify early on. Like I said, we worked to create a short list of the programs. We worked collaboratively with the county to identify that short list of eligible programs. Like Commissioner Stegman said, we couldn't include SNAP, and that was really, something that would have been an incredible program to include. Additional other programs, we weren't able to include. So we really had to identify that short list. But there was a good amount of programs that, we were able to identify as eligible programs that weren't blocked by kind of that login process, to really make sure that we could include all of those that are available for county residents. Once those were identified, really taking all of them and including them within one application is the secret sauce. That's really what this is all about. And being able to have all of those now in one application was really the impetus for all of this. As Commissioner Stegman said, for families, reducing the number of questions they were being asked from 84 to 19 is such a huge time saver. For seniors, from 70 to 17 is an incredible time saver, and it reduces those barriers. And with all that, we reduced it basically as it was an 80% of reduction in application complexities. People weren't having to navigate down potential rabbit hole of even how to find the application in the first place, let alone filling it out, completing it, and knowing, how to submit it, if they submit it by mail, that sort of thing. So really reducing just the barriers of the front door was huge. Now we're able to have you can see here on the slide, the average number of applications that people were eligible for was 2.13 applications. But I think what we're finding on the higher end that was really exciting was a lot of our applicants, particularly who were eligible for quite a few programs, were able to have 6 applications submitted on their behalf. And that's really huge, really saving the number of places that someone has to go to, saving the number of clicks someone needs to make was really important. And that was a really exciting part. That's how we were able to kind of improve that efficiency, not only for the user, but again, like Commissioner Stegman indicated, for the CBOs in the community. It's reducing the number of calls they're getting, or maybe inquiries walk-ins they're getting. And so really making sure that efficiency is created among all parties was really important.
Thank you so much, Kelsey, for giving us that snapshot about how things actually are executed. I'd like to shift gears to Dr. Goldsmith. Dr. Goldsmith, I'd like to just ask you kind of a high-level question, and then I'd love to head into the demonstration so that our participants can see how the platform operates, and then kind of come back in, Dr. Goldsmith, to also get some more additional insight from you. And I think we'll have a great connection with those that are with us, so they can actually contextually see some of the things that you're describing, if that makes sense. Okay. And so as we, again, step back from a more macro, just nationwide perspective, could you share just with your extensive experience in urban policy and the strategic impact work that you are contributing to across the nation, what are you seeing as like the biggest policy challenges? And then what are some of the biggest opportunities that you see in helping to close the benefits access gap? Would love to hear from you here. Dr. Goldsmith, you're muted.
Just really quickly, because I know you want to use the time for the demonstration. Let me make two short comments. One, what Multnomah County has done is a national example. It's quite exceptional, and hopefully it'll pave the way for other counties and states to do the same things. What we see here is fairly obvious to the folks who are on the call, right? Which is that the federal government and state governments design programs to help people who are in need. Each of those programs goes through a separate agency. It has a separate set of rules, has a separate set of eligibility. I just finished a book called Growing Fairly, where we interviewed 200 nonprofits and probably a dozen different workforce boards and other organizations involved in economic mobility. And the life of a person who is struggling is a very complex life, as we all know, right? And to the extent that the government makes that person maneuver through different government agencies, find a bus, find a childcare, go to office 1, go back for office 2, let alone the fact that he or she needs those services immediately and can't get them for a period of time, it frustrates people and prevents them from the economic mobility they need for their families. So what Multnomah County has done, which is quite different than most other places, is look at these problems from the perspective of the resident who needs the help, instead of from the perspective of the agency who's delivering the help. And so with current AI tools, such as the ones that you have, Asia, it's possible now to build these front ends which deliver the services to the residents on the terms they need. I wrote something some months ago, or some years ago. I'll close with this, which it's almost as if you wanted a hamburger from McDonald's. You'd have to go to the first McDonald's to buy the beef, the second McDonald's to buy the bun, the third McDonald's to buy the Diet Coke, and the fourth to pay for the whole thing, right? What we've now done is brought this together in terms that benefit the residents. Quite an extraordinary thing.
Thank you, Dr. Goldsmith. Your context is just really powerful, because you have really been focusing on spearheading just the policy driving work across the nation for many years in this particular area. And I can just share, Commissioner Stegman, when he learned about the Multnomah pilot, just twinkles in Dr. Goldsmith's eyes. He had just written some articles in the marketplace about it and continue to just elevate the possibilities in academia and even his intersection in policy. So it's really exciting to see the hamburger being made and put in one accessible accessible package for the residents and businesses, because they deserve it. They deserve to have government work for them. And so I really love to just share with our webinar participants what this looks like, and then come back to you, Dr. Goldsmith and Commissioner Stegman, to just talk more about what we're seeing in real time with our participants here. So I'll hand it over to Melissa Freeney-Young, who is our Director of Impact. Melissa, I'd love for you to just give a brief introduction about your expertise in government, and then take us right into our demonstration here today. Thank you.
Awesome. Thank you all for being here today. Melissa Freeney-Young. I'm the Director of Impact. I have worked in government for over 7 years with Asia Brown, have also worked in the private sector on behalf of nonprofits, make grants to nonprofits, just really a person of the community, and just so excited to be at Forward, where we are really using technology to make access to benefits easier. We all want to be able to access benefits with a click of a button, and Forward is here to make it happen. So I'm excited to jump in and share an example of what Multnomah County is working with. This is the view. Can you all see my screen? This is actually the view. We'll be looking at this from the view of the applicant. This website will be hosted on Multnomah County's website. The link will be available. So you create a super easy login, and you go in and you press apply. What's really, really powerful about this platform is we can customize this to the specific jurisdiction that's hosting this application. It doesn't have to look like Forward. We want it to look like yours. We want the community to know that you are offering this resource to them. So once you get into the application, super simple. This is available in any language, as the commissioner mentioned, that your community needs. And it's also available on mobile. A lot of folks access their applications, complete applications directly from their phone. The view we're looking at now is on a desktop. And so the most powerful piece of this application is this eligibility review. We'll go in as if we were Tina Doe, and we'll answer these 8 simple questions. These are high-level eligibility questions, just so that the program can filter what you're eligible for. So do you live in the county? What's your living situation? Do you have children? Are you a caregiver? We also make the application super simple, where folks don't have to really think too much about what to select. We give some options there that can fill in this piece here. Also, do you receive any other services? A lot of times, if you receive one service, that automatically lets us know that you qualify for another program. And so we make that super simple for folks to select. They'll go in, make those selections, and press save. The application is thinking, and on the back end, it is going through those high-level questions, those 8 questions, to determine, out of all 20 programs that are available within this common application, what you actually qualify for. So for this family, there's Big Brother, Big Sister, there's Healthy Birth Initiative, there's Meals on Wheels, there's Women, Infant, and Children, which is WIC. There are about 8 or 9 applications or programs that this one specific resident qualifies for. And what's really important for this in this part is it won't pop up anything that they don't qualify for. You don't have to waste time to complete an application. And once you complete it, then they tell you you're ineligible. That's such a waste of time. It's frustrating. Oftentimes when that happens one time, you spend 20, 30 minutes completing an application. You're no longer, you find out at the end you're not eligible. You just want to be through with it. At that point, a lot of people just don't even continue. They don't seek other resources because they put all of their effort and time into one. And at the end of the day, they wasted their time. So you go and you can actually unselect if you don't want to do WIC. If you don't want to do the replacement program, you can unselect. But for the sake of the demo, we'll press save. And then it will take us to the next section where we actually input our applicant information. As Kelsey mentioned, a lot of information across all 20 of these programs are very common. And so in this applicant section, you'll do physical address, contact information, demographics. And again, our team has looked at all 20 applications. They've pulled out what are the most common pieces of information that appear across all 20, and they make it super simple for a person to add that information. Again, we have very smart tools to make sure that the address is correct, and to help people input that information. We'll press save and continue. The next one I think is really powerful is household information. I think we all experience this when it comes to applying for taxes or doing our taxes or anything like that. It's what is your household made of? So you have your household member, you have your children, you may have a spouse. So before you get into any specific application, you can go here and you can add a household member. I'll show you as we move through the application. It makes it super simple for applicants, if this is a program specific for children, to just click through and find your child's name to add them to that application. As you can see, it's very, very simple. And this information kind of populates based on what was inputted before in the other sections. So we're going to go ahead and press save. At the bottom here, you'll see total household income. So they don't even have to do the math. If there are 3 people in your household that are making an income, you'll have all that information here at the bottom. And this also will help populate as you continue through different applications if that information is required. So we'll go ahead and press save here. And so on this left-hand bar, you see these 4 top areas. So these were like the most common questions, again, that will be applied across all programs. And as you see at the bottom, you have sections for healthy families, WIC, healthy birth initiative. So these are all the programs that applicant qualifies for. But as it's been mentioned throughout the webinar, now we'll get into the specifics for each program. And so for healthy families, they may want some referral information. For this one specifically is about if you are pregnant, what is the due date, the baby's name and things like that. And so we'll press save because we want to apply for that one. And then I just want to show you really quickly here for the WIC. WIC is a super popular program. You can actually add a child down here. So of course, WIC is really based on how many children are that you care for. And so you can go here, add child, and you can select one. So remember in the beginning, we put in all of our household information. So we can easily add Jessica. And so now that child is now on your application for WIC. And imagine how long it normally takes to complete a WIC application. You just did 3 or 4 tabs. You came in here, you added your children, and you can add any eligibility questions that are in those applications and press save. And so this is just an example of how the common application works for Multnomah County. Again, it's super customizable. It can come in several different languages. It takes 80 questions to 12 questions. And our team works really, really hard to make sure that this, again, is simple for residents, because the point here is to make it easy for them to apply and easy for them to receive their benefit. You can see there's, again, for every application. And then once all the questions are answered, you go to the bottom here, you do electronic signature, attestation, and the application is submitted. Boom, bow, boom, 15 minutes. You've applied as a mother of 3 children. You've applied for 10 programs in, again, less than 30 minutes. And like, how powerful is that? And so thanks for the time for the demo. I'll pass it back over to Asia to continue our dynamic conversation.
Absolutely. I'm going to just ask Dr. Goldsmith some contextual couple questions, and then I'd love to open it up for Q&A, and we're happy to just engage with you all through conversation. Dr. Goldsmith, just based on what we've discussed and demonstrated today with Common Application, could you just share, and we really focused in on the user experience from a constituent perspective and really accessing the system. Could you also just discuss really from a policy perspective, what additional opportunities or enablements are now possible for data-driven decision-making? Like, what does this empower the public agency to do with this common application and unified system?
Well, you call it a common application, which it is, of course, and it's the biggest breakthrough. But for my work, the breakthrough is it allows the person, whether it's a community-based organization dealing with a constituent or it's the city dealing with an applicant, to configure and deliver the resources that person needs, right? So we know that across the country, and this is true in every state in the U.S., there are tens of millions and nationally billions of dollars that are authorized that aren't delivered to the people who need them because of the mystery of it. You all have solved the mystery through the technology. So what we can do now is configure the solutions to individuals. And the biggest obstacles now, as you have shown, are not the AI. It takes a leader like in Multnomah County and a lawyer who can solve the legal problems, right? We tried to do this in New York City, and every time we brought the agencies together, they would bring more of their lawyers with them to tell us why they couldn't share the data. And most of that legal work was actually folklore. It wasn't actually restriction. So if we have a leader and we have appointed by the county executive or the mayor or the city manager, a lawyer to help solve the problems, then we can deliver those resources in real time in a way that makes a difference to the individuals who really want economic mobility in their lives.
Thank you, Dr. Goldsmith. You touched on a really powerful point about how to make change happen. And I'd love to open that question up broadly as well to Commissioner Stegman, who is really at the helm of executing this work from her jurisdictional perspective. And then lastly, if Kelsey Martin would like to share, we're really fortunate to have a really robust panelist that have been in the public sector's experience and have done this work to really just highlight, like, how do we make change happen? Commissioner Stegman, I'm going to hand it over to you.
Thank you, Asia. Well, I'm going to kind of answer more than just that, but I just wanted to highlight that I looked at a report from the White House that by one estimate, every year, more than $140 billion in government benefits that Congress has authorized goes unclaimed. And according to the National Council on Aging, over $30 billion of financial assistance goes unclaimed each year by seniors. So I think, using the data dashboard that Forward has also provided, not only, on the front end, can we get resources to people, but on the back end, we can start using that data to allocate where our resources should be going and be better stewards of taxpayer dollars. The other thing I wanted to mention is something called the National Council of Aging's benefits checkup. This is a great website, but it's just for seniors. So you can go there and you can see what potential programs might be available for, to you, but you still have to go to individual websites and you still have to complete multiple applications. But a big shout out, State of Oregon, they do have something called the Oregon One Eligibility website where you can apply for medical, food, cash, and child assistance. So just knowing that all of these resources and Dr. Goldsmith, Professor Goldsmith, what I wanted to say is, like, I remember the sign at McDonald's of, over 1 billion hamburgers sold. And, like, that's my goal. Over 1 billion common applications, got, out into the public, into our community's hands to receive resources, and they didn't have to go to 5 different McDonald's. So anyway, I would just say, just having the ability, like, once you can prove the efficacy, the lower costs, the ability to access resources, it really boils down to just, social, financial, and economic sense. And if you can make that case to your colleagues, to your departments, to your partners, they will come along with you. And thanks to the work of Forward and my team, big shout out to Leanna Mori, who was my policy advisor, who led much of this work and did much of the behind the scenes work. It really is just a team effort. And just, never giving up and just saying, we have a vision. We think that we can improve things for people. We want to bring you along. Do you see the vision that we have? And if they don't, we did everything to help them see the vision that we had. And thankfully, they did.
Thank you, Commissioner, for really highlighting the extent that there is a need to access benefits nationwide. This is literally a nationwide epidemic. Every year, Congress and Senate, they approve billions upon billions of dollars to get into the hands of residents and businesses alike, and less than half actually receive that aid. And so this is something that, regardless of political viewpoint, this is a nonpartisan issue, getting help to people and businesses. And so these systems like Forward really make it possible to do that. But I want to just underscore and double click on the vision and very much the goodwill to act in unity to solve these problems. And it really, so just I would love to just commend your leadership and your organization for really putting the people's business first and figuring out, like, how do we solve these problems, and technology is here to help do that with Forward. We're really excited about, we're talking about hamburgers and a billion sold and billion access, and our internal goal is to continue to break down over a billion silos and to help government to really expand the way that they're able to help people and to make it easy for humans to get what they need. And so I want to take a second, and Kelsey, you're feel free to add anything here, but I'd love to open it up to Q&A. We have some wonderful public servants here, and would love to hear any questions that they may have. And if anything else becomes apparent for our panelists, feel free to open up.
Hey,
here.
Asia, while you wait for a question, can you, is our audio still on? Can you hear me?
Yes, I can.
I was in a meeting for several hours yesterday in Indianapolis with a leading faith-based community organization that wants to resolve the frustration that the commissioner's been talking about in the following way, that they want to go door to door with tablets and collect the data from their residents, right? The residents they serve every day. Collect that data, put it in your format, and then upload it to the state and county for benefit eligibility, because they think that that's for them to serve their families. That is possible, right? With what we've talked about, it would be kind of a hybrid form of what Multnomah County's done, right?
Oh, absolutely. It is definitely possible for Forward to help facilitate just a multi-level administration or benefits access approach. So community benefits organizations currently use Forward as their front end that enables them to connect with constituents. We administer programs across the nation. Even with, we're doing a program now with Los Angeles County to connect domestic violence survivors to critical resources. And the front line is not the county or their workers, is actually 9 really wonderful, competent, effective community-based organizations that work directly with that sensitive population, and they use Forward. And so regardless, there are some really large organizations and then really small ones that they're all using the same platform. So it really democratizes the ability for community organizations to serve people. And we all very much recognize that community-based organizations are very much a part of critical connective tissue in our communities that innately understand the obstacles and the barriers and the unique needs that our residents and communities face at a very micro level. So, Stephen, thank you for your question. Absolutely, Forward is able to open up those channels to provide access to aid through community-based organizations or spearheaded by governmental agencies or even a combination thereof. So we're able to really be a convener and help to answer the questions and break down the silos necessary to get these program dollars flowing where they need to go. So thank you for that. Okay, I'll start taking questions, or feel free to flag them for me as well, Tina. But I have one question I see from Sandra Tang, and it says, so happy to hear that Forward is helping Multnomah County. Was wondering how Forward is expanding to other counties and what challenges is Forward facing to expand to integrate with other counties. That's a really wonderful question. And of course, Sandra is coming from Multnomah. I believe I saw that earlier, but I could be wrong. But yes, Forward is very much navigating in the marketplace. We work with counties, as I just mentioned, throughout the United States. We've also explored benefits access with communities-based organizations where they're spearheading closing the benefits gap. It's interesting. I'm going to defer to Stephen as well to just share broadly what we're seeing about the desire to close the benefits access gap from a policy priority. We're currently in conversations even with some large cities that are trying to figure out how they restructure benefits access systems for some very long-standing programs, including like general relief, but that also touch a city and also a county for like fund flow. So we're kind of a facilitator and we're able, again, to just deliver the solutions, but it really goes back to the legal will that Dr. Goldsmith and Commissioner Stegman touched on as well, just getting those folks in the room that want to solve these problems and then tearing down those barriers to make that happen. So if you are interested in partnering with Forward to help be a convener and to really help figure out which problems or barriers need to be broken down, we're happy to connect with you, and we'll have an opportunity to connect as well. Oh, actually, I see the QR code. You can scan us, and we're happy to connect and strategize with you at any time. Any additional questions? I see one question here. It says, once the common application is completed and the data is forwarded to the service provider, does forward continue in the applicant's journey, or is the relationship completed after the data handoff? And so Forward we're a system that also includes humans, customer support. We even have case management capabilities. And so it really depends on the level of deployment of Forward for that jurisdiction. So the short answer is yes, we can continue to support that applicant. We actually see each applicant as a case that we want to get to a completed close, but then also continue to service them and their unique needs as they go along their journey to self-sufficiency and upward mobility. So we are here, we are a long-term partner. We can provide additional support, and then we have additional capabilities. Again, it just really depends on how we're deployed in partnership with that jurisdiction or community organization. Thank you for that question. And then I see Rhonda Brown, and it says, I imagine a cloud-based platform system is required to work across government and community agencies. Can you describe the technology a little? Absolutely. Forward does operate our technology on a cloud system. We currently work with both Microsoft Azure and also AWS, which is an Amazon cloud. All of our technology servers and systems are maintained in the United States. And so we also deploy the highest level of security for all of our data. And we also retain ownership of data to our jurisdictional partners. So we don't own your data. We do manage it and back it up. And when it's time to respond to audit requests, or when you all decide to actually close your programs or even continue to archive them, we work with you all to conclusion with that data. But we do not sell data, but we do manage it and make sure that it's protected. I don't know, we're concluding our webinar. And if you all have additional questions, feel free to drop them in the chat. I encourage you to access the QR code. You can schedule just a no obligation, no pressure strategy session with our members of Forward today. 85% of our team members either have governmental or nonprofit expertise. We are excited about solving the problems of government. We're very passionate about this work. We know that when government works, our nation works, and people and families, they get what they need. And so thank you, Commissioner Stegman, for your leadership, for your time, and also just your context that you shared about how to make change work. And Dr. Goldsmith, just want to thank you for your continued leadership in academia and policy about the possibilities of changing governmental systems. You've dedicated a career to doing just that. You're very unique in that you have both academic expertise, but very much you are a practitioner in your own right, being a former mayor in Indiana and also a deputy mayor in the city of New York. And so we thank you for continuing to be a thought partner with Forward and how we navigate delivering high quality technology and human-centered support and people to our jurisdictional partners across the nation. And so lastly, we just encourage you to stay connected. There are many ways that we can support and serve. And the biggest thing that we enjoy doing is just listening to the problems that you're trying to solve in real time. Generally, 99% of the time, there's a way that Forward can help. So feel free to reach out to us and we'll be happy to connect with you. And again, thank you all for your time and your participation in today's webinar.